Good afternoon, everyone, and thank you for joining us today for this webinar. My name is Ann Wong, and I am with the Illinois Chapter American Academy of Pediatrics. Today we are joined by Dr. Marielle Frechon, the Medical Director of Immunizations at CDPH. She will be discussing the CHIP transition. Before we begin, I would just like to go over a few housekeeping items. Participant phone lines are muted. This webinar is being recorded. Everyone will receive a copy of the PowerPoint slides, a link to the webinar, a link to complete the webinar, and a link to the recording of the webinar by the end of business day. We are now going to have Dr. Frechon speak.
Much.
Okay.
Thanks very much. Can you see my screen?
Yes.
Okay, great. Hi, everyone, and thanks for joining us, hopefully on your lunch break. We appreciate you taking the time to clarify and talk about some of the changes that we've seen in the VFC program and this overall CHIP transition this month. So I'm going to jump right in and give you a little bit of an overview of what we've seen, just to reinforce some of the ideas that are really important as we look towards implementing these changes. So, as many of you know, the Children's Health Insurance Program started in 1997 as a companion program to Medicaid, and that was a way to serve uninsured kids whose family income exceeded the Medicaid eligibility levels. And so in Illinois, we called the program All Kids, and that included Medicaid children who are referred to as Title 19, as well as CHIP or state-funded children, also referred to as Title 21 eligibility. Those were all rolled into a larger program referred to as All Kids. And before October 1st, 2016, all of those children who were enrolled in All Kids received VFC vaccine. Now, this was because of a model that the state used to distribute CHIP vaccine under the VFC program. Since October 1st, 2016, we are now looking at a model where Title 19 or Medicaid children continue to receive VFC vaccine, but Title 21, also referred to as CHIP or state-funded children, receive private stock vaccine because they technically do have insurance and so can no longer have vaccine distributed to them under the VFC program. Now, each state set their own guidelines for how to implement CHIP, and so when you think about which children are in this program, it's useful to know how Illinois decided to implement the CHIP program. So this is a fact sheet from the AAP put out in 2014 that describes how the modified adjusted gross income for each family is assessed, and families or children are then put into a Medicaid expansion program, which is for ages 6 to 18, or a separate CHIP program. And Illinois is one of 40 states that decided to sort of use the CHIP program in this way. 2 states only have separate CHIP programs, and 8 states only do Medicaid expansion. Illinois decided to be one of the 40 states that does both. Now you can see that the adjusted gross income is 142 to almost 300% of the federal poverty level. And so this is the population of children that are being served under this CHIP or Title 21 or state-funded category. Here you can see the current income eligibility requirements for each level of CHIP, and this is on the HFS website listed below. And you could reference it. But this is really to give you a background of who these children are These children have been in your practice since 1997, but they received, everything that they received in terms of services and vaccine was almost indistinguishable from Medicaid children, except that some levels of this program did require co-payment. So it's difficult for your practices, and we understand this at the health department, to now try to assess your practice and decide who is under the CHIP program and who is not. It's difficult to run those types of reports. So we're encouraging all of you to systematically try to assess the volume in your practice, and one of those ways is starting with what our expectations were October 1st, which is using the MEDI system to screen for the eligibility of these children. So since October 1st, 2016, what we've said is that providers must verify eligibility for every patient on the date of encounter, and that's very important. You can't be screening a roster of patients a week before and then use that eligibility. It has to be on the day of the encounter. And this helps you to determine which vaccine to use, whether it's the VFC stock or your private stock. And that helps you to know how you're going to bill. And we're going to talk about that in a few moments. So the way that you verify eligibility could be through two mechanisms. For most of you, it'll be through the MEDI system, which I just referred to, which you can find at myhfs.illinois.gov. You could also contract another vendor to help you display eligibility information, but you have to make sure ahead of time that that vendor is able to distinguish between Title 19 and 21 eligibility. And there's some more details on the slide below about what you need to communicate to those vendors. Hopefully, most of you have already initiated using the MEDI system, and there are several stages of being registered for MEDI. If you were already registered for MEDI, you could go back in there and determine who was an administrator and add more employees by using an employee registration key. But if you're new to MEDI, then you had to obtain an Illinois digital ID, register for MEDI, and there's a helpline provided there if anybody needs additional help with that. And this could take 48, 72 hours to get to this point, and then employees could register with an employee registration key, and then the administrator would have to approve the access to the Internet Electronic Claims System. And that's the system that you need to be using at your front desks and in your workflow to perform eligibility inquiries for each patient at every visit. And there is more information about this process on the HFS website, and we, in our VFC news bulletins, have been trying to get those links out to you to help you start these processes. Hopefully most of you are already done with getting into the MEDI system and are already starting to use it. And so I'm going to go over now some of just a basic overview of what you'll see in the MEDI system, and then go into more specific examples and sort of tackle some of the big issues that we're hearing from providers that's confusing in the MEDI system. So this is a very basic, this is the most basic level that I can give you about who receives VFC vaccine versus privately purchased vaccine. In the left-hand column, you'll see what the MEDI special information section will say. So there'll be, under the special information may be Title 19, the Roman numerals, and then 19. And if it's Title 19 and they are 18 years or younger, then you're using VFC vaccine still. And you're going to bill HFS for procedural code for the vaccine as well as for an office visit code. You will not use privately purchased vaccine for that population. Now, if this is a Title 19 patient and they are 19 years old or older, then they do not qualify for VFC vaccine, just a reminder. If under the special information section you see the patient is Title 21, which is the CHIP program, or state funded, which is also the CHIP program, then you cannot use VFC vaccine. You must use privately purchased vaccine. In that scenario, you'd be billing HFS for vaccine codes and vaccine procedural codes and office visit codes if there's no information about a managed care organization. If, and I'll show you an example later of the difference, if the patient is enrolled in a managed care organization, then the billing goes to them. And we'll talk more about that in detail. A big point I want to make is that there's another category under the special information section that's called state funded, but that's for DHS social services. That does not cover vaccines or medical coverage at all. That DHS social services has nothing to do with eligibility for vaccines, but it's very confusing because it's also labeled state funded under your special information section. So if you see DHS social services state funded and there's no evidence of any alternate medical coverage, then that patient does qualify for VFC vaccine. But you do have to do your due diligence in finding out if they have some other insurance. Each slide that I go through now is going to get a little more complicated in terms of the information for the breakdown of each level within all kids. So before, we separated all kids into Title 19 and Title 21. This one breaks them down in terms of levels a little bit more because, like I talked about at the beginning, depending on your family income, you may be in a different level within the CHIP program. So the three boxes in the middle of this slide refer to the CHIP program. They're different levels. They may show up as different titles under the special information, but the take-home message is that they are CHIP and you must use private stock for those patients. If you go to the top of the slide, you can see that all kids Medicaid eligible full coverage with the special information Title 19 refers to the population where you are still using VFC vaccine. And then all kids share, all kids premium level 1, all kids premium level 2, with the special information listed in the second column, will receive private stock. Again, I want to make a big point. DHS social services will also say state funded, but that does not refer to medical coverage. Now we're going to get even a layer deeper than that. You can see this first under the case type, all kids Medicaid eligible. And this is from, these slides are from HFS. All kids Medicaid eligible, you can have a patient who is Title 19, who you will be billing HFS. They might be a Title 19 patient who's also enrolled in a managed care organization, in which case you're using VFC vaccine, but you're billing the managed care organization. There's also a third level where they could have Title 19 eligibility but also have third-party liability or private insurance. In this case, providers are not required to bill the primary insurance for preventive service to children, and we would say that you should use VFC vaccine for these children. And for billing issues where we want to make sure that you are reimbursed appropriately. So, but it is ultimately your choice of who you bill. All kids share or all kids premium level 1 is separated into children who have Title 21 eligibility, where you will use private stock, and then you'll bill HFS, and we'll go into those details in a moment. Or they could be Title 21 enrolled in a managed care organization, in which case you're using private stock and billing the managed care organization. They could also show up as Title 21 with third-party liability. And again, like the Title 19 patients who have third-party liability, you're not required to bill the primary insurance for preventive services to children, but you must use your private stock vaccine. For All Kids Premium Level 2, these are referred to as state-funded, but again, you may be billing HFS or a managed care organization or have the option to bill a third party. For DHS Social Services at the bottom, again, I can't reinforce this enough. Your CHIP population could be very if you are interpreting DHS Social Services state-funded as CHIP. These children, again, this does not apply, does not refer to their medical coverage. The information does not apply to vaccines, and so you need to look for whether they have additional medical coverage. If they do not, then they are eligible for VFC vaccine. One specific point that we've been hearing from questions from providers about is the difference between an administration code and a vaccine procedural code. So for private insurance, not HFS, providers can bill 3 codes: the vaccine code, an administration code, and the appropriate office visit code. When you are billing HFS, providers can bill 2 codes: the vaccine code, which if you're using VFC vaccine, you get $6.40 for the VFC vaccine, and then you bill an appropriate office visit code. If this is a CHIP patient and you're using private stock and the patient is not enrolled in a managed care organization, you'll be billing HFS for a vaccine code that will reimburse the cost of the vaccine per their reimbursement schedule that's published. And then you'll also be billing for the appropriate office visit code. So this distinction is very important because in previous communications, some of the language has overlapped, and we've talked about billing vaccine administration for VFC vaccine. But it gets more complicated than that for the billers who need to know that the specific administration code should not go to HFS. It should be a vaccine code and an office visit code. And if anyone has additional questions about this, you can reach out to us and we'll try to clarify them further. So how do you determine eligibility in Medi? You have to use all the information that's provided to you. You have to use the case type, the special information section, whether a managed care organization is listed, and whether third-party liability is listed. So I'm going to go through some examples to create some take-home points here, because every patient is different and every patient has a different situation that may make things more complicated. So one important factor that we need to talk about is Title 19 patients who are enrolled in managed care organizations. Their case type will be all kids, Medicaid eligible, with special information, Title 19, and then there will be a managed care organization section below that. And it will have a plan code, which is also 19. That plan code may be different, but that plan code does not refer to their title eligibility. And so that can be confusing because that number pops up. You do not want to look at the plan code when you're talking about title eligibility. You only want to look at the special information. And then note that they're in a managed care organization because that will affect billing. This patient is Title 21 and also enrolled in a managed care organization. You can see their plan code is 19 also, but that doesn't tell you title eligibility. You have to look at the special information section for title eligibility. So for this Title 21 patient, you'll be using private stock vaccine and then billing the managed care organization. This patient is a Title 21 patient, and this is showing how eligibility can change from month to month. So one issue that many providers are asking us is, how do we screen using their medical card? You can't. The medical card is distributed yearly, and eligibility can technically change any time during a certain calendar year. It can even be reassessed month to month. So in this situation, this patient had Title 21 eligibility for the month of April. And starting May 1st, they had Title 19 eligibility. So depending on the date of encounter, you have to refer to the begin and end date of that encounter to get the specific title information for that day. So it could be confusing because someone may look at the first eligibility section and think they need to use private stock, whereas if you're looking at the date of encounter, it might be a different eligibility. So you have to be careful there. Again, this is my big take-home point, and I know I'm beating a dead horse here, but if there is an eligibility, for example, in this case, Title 19, special information saying Title 19, and then a separate category that says DHS Social Services saying state funded in the special information, this patient is Title 19 eligible and they can receive VFC vaccine. The fact that it says state funded below that under the DHS Social Services does not refer to medical coverage. And so you should ignore that section. If this DHS Social Services is the only case type that appears, you have to investigate other payment sources. If that truly is the only that is the only information in the system and they have no other medical coverage, then they could receive VFC vaccine. Now this is a situation where the patient has Title 19 eligibility as well as third-party liability. So if you look below at the example, you'll see the special information is Title 19. You'll also see a DHS Social Services box that says state funded. So again, you're going to be ignoring that in this scenario. And then you see this third-party liability box. And this is important because, as we talked about before, the provider can choose who to bill. But in this scenario, it's totally okay to use VFC stock. This is third-party liability with Title 21 eligibility. Now in this situation, you can see that your special information section says state funded, so we're talking about a CHIP insured child, and then you have third-party liability below. Again, you're not required to bill the primary insurance for preventive services to children, but in this scenario you must use private stock. And if you decide to use private stock, you could still bill HFS for the vaccine code. This page has billing instructions for encounter rate clinics as well as private providers. I encourage you to reference it. If there's anything that's not answered on this page, feel free to email us at chicagobfc@cityofchicago.org and we can try to find the answer for you. We want you to be able to bill for reimbursement for vaccine if you're using private stock. We encourage you to be buying private stock now for these children, and we want to troubleshoot with you if you're having trouble billing or if you're unsure about the managed care organization systems currently. They will also, the Medi example slides that I just showed you are from HFS, and they are also posted on this non-institutional provider page with all the information I discussed, so you can also reference those. Another point I want to make is that moving forward, in order for us to know what proportion of your clinic population is CHIP insured versus Title 19 or Medicaid insured, it's helpful for us to see every patient that you give vaccines to in iCare with the appropriate codes listed. I think it helps both of us if your practice starts using these codes. So that means even if your patient has private insurance, you still enter that information into iCare because it's important information for that child moving forward in their health care in general. And so in that way, even if you're using private stock, for CHIP patients, you could enter the code V22, and that would signal to us that you use private stock, but that you saw a certain number of CHIP patients. And that would be extremely useful information to us so we can continue to support you in this transition. So I'm going to go over some common provider questions, and hopefully this answers some of the questions that you have. When will managed care organizations reimburse Title 21 vaccine claims? This is a very complicated question, but we are discussing how to have the MCOs communicate with providers in a very specific way. The MCOs did not previously receive Title 21 eligibility information, and so HFS is supplying that information this week, and the MCOs will be updating their systems to interpret the eligibility. Some MCOs are pending claims, and from what we know, we're still encouraging all providers to submit claims. And we are advocating for the MCOs to be reimbursing at 100% of the HFS posted rates. We want them to communicate a specific timeline to you so that you can make decisions, and we will continue to be in discussions with HFS and with them about making sure that that happens. I know that this is a big concern for a lot of providers out there, as many of these CHIP Title 21 state-funded children are enrolled in managed care organizations, and if you're using private stock, you want to make sure that that cost is reimbursed. We understand that, and are working towards a specific timeline. Right now, we're looking at somewhere in November or December. That is subject to change, and we hope that the MCOs will be reaching out to you directly with exactly what time frame they'll start reimbursing the claims. What are the options for referring patients if your practice cannot afford the cost of vaccine? We understand that this is a very real concern. We want you to think about what your plan is for the next month. If you've already purchased private vaccine, then continue to count your CHIP patients and try to make decisions about how much you'll need. If you think you'll be able to purchase private vaccine within the next month, then in the meantime, you can refer to our city fast-track immunization-only clinics. If you don't foresee being able to purchase private vaccine, and you've really sat down and thought about it, and it's not going to be financially possible, we want you to start thinking about referring to an FQHC or another provider as a new medical home. We also understand that this transition sometimes takes time, and that depending on which MCO they have, it might be difficult to find another provider. In that limbo period for that child, if we have not been able to provide emergency 317 vaccine to you, you can refer those patients to our fast-track clinics if you have no private stock to vaccinate them with. We do not want children who are in the process of transitioning to a medical home that could provide vaccine to them as CHIP patients to be lost in the shuffle. We want them to be vaccinated. We don't want there to be missed opportunities. And that, this is not an ideal situation, but as long as we're all honest about what our plans are in the next month in terms of purchasing private vaccine or not, then these fast-track clinics can be used as a safety net for these children. The list of fast-track clinics is on the website listed below. You can also just search for Chicago fast-track immunization clinics and the schedules will come up. They're not all open 5 days a week, and so you have to be careful communicating to families the exact hours and days of the week that they're open. But we do have a small amount of stock available for CHIP patients. Now we're hearing a lot from providers that vaccine is expensive and the HFS reimbursement schedule does not quite cover the full cost, and that gap will add up. So how am I expected to purchase vaccine without being reimbursed the full amount? we'd like to encourage you to start discussing with vendors, colleagues, and also larger academic affiliates whether you can join a buying club to perhaps get some lower vaccine prices so that you will end up being reimbursed more towards 100% of the vaccine cost. Advocacy is underway to make sure that the reimbursement schedule reflects what you are actually paying, because we know that this is a concern. And so a lot of this is in process, but we hear you, and the advocacy organizations hear you. But in the meantime, you can start having conversations and trying to get into buying clubs. This is another set of questions that we've been receiving about specific situations walking through your door. One of them being, what happens if the newborn eligibility that you're seeing in Medi doesn't quite make sense? For example, if a newborn comes into the office and their insurance is pending and mom is Title 21, what do you do? So if the insurance is pending, the infant is technically uninsured on that date of encounter, and that newborn can receive VFC vaccine. You'll be billing HFS a vaccine code and an office visit code, but not an administration code. I just wanted to make that point again. Now, this situation is okay even if the infant ends up being Title 21 in a month. Because they were VFC eligible on the date of encounter, it's okay to use VFC vaccine for that newborn if the insurance is pending. So what if a newborn comes into the office and what you see in Medi is that their eligibility is Title 21, but you also know that mom is undocumented and uninsured. So what we've learned is that the unborn child of an undocumented or incarcerated woman in Illinois is considered Title 21 until they are admitted to labor and delivery. Under an emergency medical coverage route, the eligibility changes to Title 19 from labor and delivery through 1 year of life, and then eligibility is reassessed. So if you know a mother in your practice is undocumented and a newborn comes in for a visit and they're listed as Title 21, that should definitely perk up your ears and make you stop and think. Please contact us if you see that, if something doesn't make sense, and we'll work to advise that provider about next steps. There are rare scenarios where All Kids Premium Level 2 mothers may have newborns that are also Title 21. But that's a pretty rare situation. So it is possible for a newborn to come in as Title 21. But if you know that the mother is uninsured or undocumented, then there needs to sort of be a thought in your screening process that maybe that newborn needs the computer system updated to reflect their true eligibility, and we can help work through that. So what if the Medi system is down or not working? We heard that even last Friday, we heard from some providers that the Medi system was down. You can definitely contact us and let us know, and in the meantime, collect as much information from the patient as you can and document what you can. There are phone numbers that you can call, but we can't guarantee that you'll reach someone in a timely manner to be able to decide which vaccine stock to use. So we acknowledge that there might be gaps. We hope that they are minimal, but again, we want to encourage an openness with you and the Chicago VFC program, where if you're proactive and you tell us what issues you're encountering, we'll help you work through it. And as long as you're documenting what you can, then we are not in a position where we are trying to be punitive here. We want to work with you, and we want you to tell us what your challenges are and whether there are improvements that need to be made in your systems. If you notice a mistake, but it leads to a system improvement, that's okay. We're not going to be punitive. We want you to be open with us and contact us. So this is the email that you can contact us at, or our VFC News bulletins also have phone numbers that you could call. But email is probably the best route. And again, we cannot receive protected health information through that email, but you can tell us that there's a scenario and you could fax us information if there's a specific eligibility question that you have. So just give us a heads up and then we can figure out faxing that information. So next steps, what we envision here at the Chicago VFC program, we are going to be sending out a survey and attestation form for you about this chip transition. It's going to be posted on the Health Alert Network. You should be hearing about that within the next 2 weeks or so, and we need your feedback to be able to move forward. When we receive your responses, we'll be doing individual outreach, and that may be through an email, through a phone call, even through a PHA visit potentially, to troubleshoot any issues you're having, to discuss the volume of CHIP patients that you're seeing, and really do our best to support you through this process, sort of encouraging this openness between your offices and ours. We'd love for you to send us data on the number of CHIP patients that you're seeing, because as I said before, it was difficult for all of us to know the exact breakdown of Title 19 versus 21 patients in your practice, and some of us only now are realizing what proportion of your practice is CHIP patients. And so, we still want to help you find solutions, and so please keep in touch with us in that way. Here is my email address, and then again the Chicago VFC email address. And we welcome any questions through this process. Hopefully I've answered some of the more common questions, and we will continue to update you as we get new information, especially concerning MCO reimbursements, which I know is a big concern for a lot of you. So I think that's it.
Okay, thank you so much, Dr. Frashone. That was definitely very informative, and it helped clear up a lot of questions and problems that I think we've been having on our end too with questions. So that concludes our webinar on further explaining the CHIP updates. And once again, if anybody has any other future questions at all, you can just use one of these emails and send questions to them, and somebody at CDPH should be able to get back to you as soon as they're able to. I just wanted to reiterate to everybody also that you will be receiving a copy of the PowerPoint slides of everything that Dr. Frashone showed today, as well as a link to view the recorded webinar. So once again, thank you so much to everybody that joined us, and I hope that everybody has a wonderful afternoon. Thank you so much, Dr. Frashone.
Thank you.